Dr. Gounder, thank you so much for being here. So let's talk about what we were just discussing with Tessa, and that is people, even with a mask mandate, still not taking it seriously. Joe Biden's going to come into office, and he is going to be working with all of Americans to try and take this virus seriously. There's going to be a number of Americans and a number of law enforcement and local leaders who, don't take it seriously and aren't going to uphold the rules or uphold the laws, or local leaders who are just going to say, hey, listen, we don't think this is a big deal. How do you deal with that?
Yeah, this is going to be a big challenge coming into it. Unfortunately, the wearing of masks has been politicized. This is a basic hygienic measure. It is like politicizing toilet paper. And unfortunately, to reverse the clock on that is going to be very difficult. I do think one key component here is that people resist, people disbelieve when their other needs are not being met. And the abstract threat of coronavirus may not seem very urgent in contrast to the economic and social fallout of what the pandemic has caused to the economy. And so we really do need to be addressing both at the same time, and that includes having another stimulus package passed.
What about ordering nurses who are asymptomatic to continue working in hospitals?
Yeah, we're in a very difficult position right now because we do have a shortage of staff. We're coming into the holiday season when healthcare workers are exhausted from months of combating this, and when they had plans themselves to be spending some time with families, when you're going to have skeleton crews in the hospital. So this is really going to be a challenging situation. Can an asymptomatic nurse wear a mask and protect transmission to others? Yes, but at the same time, we don't always know who is going to get much, much sicker. They may initially be asymptomatic, and it would be very scary, especially since I have actually seen this firsthand, to see somebody decompensate, get sicker in front of you in the hospital, and then your colleagues are having to rush and take care of that person. That's a very scary situation to be in.
Let's talk a little bit about the vaccine. Good news today, a third vaccine that potentially could come to market. It was confusing, though, reading up on it. In some ways, it's 70% effective, and in other ways, it's 90% effective. Can you explain that to us?
Yeah, so it ranges from 60 to 90% effective depending on how it's dosed. And what they found was when they gave a half dose initially, essentially kind of priming the immune system, and then they gave a full dose as the second dose, that seemed to be the more effective strategy. And so I think what you're going to see is that they're going to hone in on that dosing and validate that, see if that really does hold up at those higher effectiveness numbers, and hopefully it does.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.